Morning, everyone, and welcome to our first Health Force Monday Spotlight session. Really great to have you all joining us. We hope that these Spotlight sessions are going to provide some bite-sized inspiration to start your week. So our aim for these sessions is to have some really great conversations with volunteer leaders from across the UK about a volunteer role or an initiative that they're really proud of and is making a difference. So we've got 15 minutes to have a conversation with our special guest today. We won't be accepting questions during this session because we won't have time to answer them all, but you are very welcome to leave your comments and questions and we'll get back to you as soon as we can after the session. So today we're thrilled to welcome two special guests from West London NHS Trust, who are going to talk to us about their new health promotion volunteer role, which is part of the Trust's Healthier Lifestyle Service. So Amalia Loisadou is the Volunteer Services Coordinator at the Trust, and Katerina Manginas is the project lead for the Health Promotion Volunteer Project, and Katerina is based in Ealing. So to start with both, could you give us an overview of the health promotion volunteer role? I wonder if I could go to you for that, Katerina.
Yeah, thank you. And good morning, everyone. So essentially what the health promotion volunteer role, it's going to be part of Ealing Community Partners, and it will include working within our diabetes health and wellness coaching service, as well as our tuberculosis awareness service. So essentially what the role entails is engaging with people within the community, within their own spaces, with reliable information around kind of diabetes as well as TB. So that could involve healthy eating, physical activity, touching upon smoking as well. And so part of the role is essentially being able to talk and speak with the local residents within Ealing and be able to outreach to them about the services we provide. And the idea with the sort of the volunteer role is to be able to have these kind of peer-to-peer conversations where people may feel safe in their community. Maybe they might not be able to approach health services, and we want to be able to engage with them in a really meaningful way. So part of our volunteer kind of role descriptions, where if people live or work in their local community, know Ealing as a whole, so that we're better able to gauge where people are essentially. So that could involve, in religious centres, local libraries, that sort of thing. So it's really just engaging with the community and where they are.
That sounds absolutely amazing, Katerina. Could you give us an idea of where the inspiration came from in the first place?
So essentially, the health promotion volunteer role was kind of a need that we had identified, that actually post-COVID, the healthcare system has changed. There's a lot of digital, shifting towards digital appointments, but we see that there's a lot of people in the community who are still wanting this face-to-face interaction with the health services. But essentially it was a need that we've identified in when we were celebrating kind of World Diabetes Day, seeing the fact that there was a lot of people who didn't know about different health services, but would really kind of gauge from that peer-to-peer support. So it was kind of a community identified need, and from that point onwards, it was really with the support of the volunteer service of actually, we've got this need, but how can we fill that gap essentially? And that's where really the volunteer service came in and supported our service to be able to get this off the ground. So I think I'm not best placed to speak about that, so I'll hand over to Amalia.
Yeah, so Amalia, if you could give us an idea of how this is going to work in practice. How are you getting this programme off the ground?
So what we do is that we're hello everybody, we're a new service, and what we do is that we do approach our colleagues and have discussions with them about any opportunities that they can identify in relation to volunteering involvement. So when we spoke to Katerina, and the idea was firstly about, we helped with shaping it into an appropriate volunteer role. We have the framework, role description templates, the relevant policies and all of that to support our colleagues with involved volunteers in a safe and appropriate way as well. So once that was completed and we had the role description, we supported with promoting the role and recruiting volunteers. At the moment, we have sent our offers to our first few volunteers. So we are have just starting our onboarding process with some relevant checks that we need to do and so on. And we will be providing our core induction training as well with the trust, and coordinate with Katerina for role-specific training that needs to be on offer as well.
Thank you, Amalia. Yeah, just on that, Catherine, what does the role-specific training entail?
So after the kind of initial trust induction, which involves infection control, health and safety, safeguarding, etc. We'll be doing our local level induction. So that local level induction will essentially be kind of an introduction to the wider team that we have within the Healthier Lifestyle Service. So the volunteers can feel part of that community as well. And essentially, it will be kind of introduction to the basics of diabetes. So an explanation of the background of the services that Ealing community partners have, as well as knowing a little bit about the basics of diabetes too. So we'll be upskilling them in that area, as well as kind of delivering our TB awareness training to the volunteers as well. As well as that, we will be doing trainings such as MEC, so it's making every contact count, as well, that the volunteers will have access to, as well as a little bit about kind of behaviour change strategies that we use as part of our approach to kind of person-centred care, so that they will be able to gauge an understanding of the way we run our clinical services, so that they will be able to understand the approach and essentially kind of, when in outreach, they can deliver that person-centred care that we really kind of promote within our team and deliver. So hopefully that answers your question.
Absolutely, thank you. I'm really interested to know what kind of qualities do you look for in a health promotion volunteer?
So, I mean, to be honest,